If you've been told that surgery is the only real option for a herniated disc in your lower back, well, that can feel simply overwhelming. Because when you're dealing with a herniated disc, it's not just the back pain. It's a sharp pain which can be shooting all the way down your legs. It can be numbness. It can be tingling, weakness, pain that affects everything. How you sit, how you move, how you sleep, how you get through your day. But before you make a major decision about surgery, there may be another way which is worth understanding more about. It's called non-surgical spinal decompression. And for the right person, it may help relieve pressure inside the spine without the need for injections, surgery, and without permanent structural changes. Now, I want to be clear. This is not about saying surgery is bad, because in certain situations, surgery is absolutely necessary. But the problem is, many cases, people are told about surgery long before they're shown all their options. So in this video, I'm going to walk you through all the different options clearly and concisely. You're going to understand what surgery does, what spinal decompression does, when surgery is necessary, and when non-surgical options are more likely to be the first choice. I'm Dr. Chris Cameron. I'm a chiropractor here in Lucan, Ontario. I work with patients dealing with herniated discs, sciatica, back pain, every single week. And one of the most common questions that I hear from the public is this: do I actually need to have surgery? Or is there maybe another option? So let's go ahead and break this question down. Most people, they only hear about spinal decompression after they've already been told about surgery as their next step. And that's a problem, because these are two very different approaches, but they're rarely explained together. So you end up making a major decision about surgery or not without fully understanding all the other options. And that's exactly what we're going to try and fix today. Before we can understand treatments, we need to understand what we're trying to treat. Think of a spinal disc like a jelly donut. The outside of the donut is rough and tough. So that's why the disc is rough and tough, but the inside is a lot softer, like a jelly donut. When the outer layer of the crust of the donut weakens, the inside of the disc can push outward. That's known as a herniated disc. But here's the key. The real problem isn't always the disc itself. The real problem is when that disc presses out and it hits on a nerve. That pressure is what creates your symptoms. Pain in your back, pain down your leg, numbness, tingling, and weakness. The size and the location and the nerve involved all will determine what treatment makes the most sense for you. When surgery is recommended, the goal is simple: relieve the pressure on the nerve. Common medical procedures we'll try to do this include a microdiscectomy, a laminectomy, or a spinal fusion. All three of these are invasive. They involve incisions, tissue disruption, and sometimes permanent changes. Now, to be fair, these approaches, they can be very effective. Many patients will get relief, and sometimes very quickly. But here's what you need to understand about these. Surgery does not restore the function of the disc. It simply removes part of it, or changes how the spine moves. Well, that can affect your spine long term. There are also risks with these procedures: infection, nerve irritation, scar tissue, reherniation. And in some cases, the pain can persist long after the surgery. Again, this doesn't mean that surgery is wrong. It means that you need to understand something. You have to understand both sides. Now, let's look at this from a different approach. Non-surgical spinal decompression. It works with the disc, not against it. It's performed with a specialized table that gently stretches the spine in a controlled manner. This creates a negative pressure inside the disc, and this is key because in some cases, this negative pressure can help draw the disc material back inwards, reducing the pressure on the nerve. And at the same time, it helps to bring oxygen and nutrients back into the disc, which disc needs to heal. The disc, especially as an adult, has a very poor blood supply. They rely simply on the movement and the pressure changes of the disc to get nutrients. So instead of removing the disc, spinal decompression tries to reduce pressure, improve movement, and support healing. No surgery, no injections, no structural changes. Now, this is where things become clear. Surgery removes pressure directly. It's fast, but has short-term relief, and is invasive. Decompression reduces pressure gradually, non-invasive, and it works over time. So you're looking at two strategies: remove the problem or support the body in healing it and correcting it. And the right choice, well, that really depends. It depends on your situation. There are times where surgery is the right call. If you have a progressive weakness of muscles, loss of bowel and bladder, severe nerve compression. Those are serious. They're not a wait and see approach. They need immediate medical care. Also, if conservative care fails over time, surgery will become the next reasonable step. But if you're not in an emergency situation and your symptoms are stable, this is where spinal decompression may make sense as a better option for you, especially if the pain travels down your leg, it's been persistent for a long time, and you've tried other conservative approaches and they haven't worked for you. Decompression gives you a chance to address the problem itself without permanent changes. And this is important. Trying decompression, that does not eliminate surgery as a later option. It simply gives you another option to try first. Research shows that both approaches can work. Surgery often helps quicker, but over time, the difference in the outcomes, it narrows considerably. And in our clinic, in 2025, we had a 78% success ratio. And what that means is 78% of the people with back and leg pain experienced a 50% greater improvement or more in the first 3 months. Those are real patient outcomes. So here's the big picture. Surgery can provide fast relief, but it's invasive with more risks. Spinal decompression can provide more gradual results, it's non-invasive, and supports the disc with very little risk. If you're in an emergency state, surgery, it just may be necessary. But if you're not in that emergency state, it often makes more sense to consider a conservative approach first. Right now, if you're dealing with a herniated disc and you want to know if spinal decompression might work for you or be right for you, the most important step to consider is getting a proper and thorough evaluation first of all. At our clinic here in Lucan, Ontario, we help patients go through this process every single day. If you'd like to learn more, the link on how to get started is down below. And if this video helped you understand more about the process, make sure you like it and share it with someone who you think might need to hear this information. I am sure right now there are people who believe surgery is their only option, and that may not be true. If you want more videos like this one, make sure you hit the subscribe button, and I'll see you in the next video.